Hi, my name is Dr. Diana Wohler. I submit this testimony in support of House Bill 7340 and against the other bills that have been proposed today. I speak as a family physician, so I take care of children, adults, pregnant women. I do deliveries, and I do also reproductive health care. My practice is based in Pawtucket, so I'm mostly serving the vulnerable families of Pawtucket and Central Falls. But I also work at hospitals in Providence and serve the greater Providence area. And I'm here to speak specifically about the Reproductive Healthcare Act, House Bill 7340. I'd like to also submit that the American Academy of Family Physicians is strongly opposed to any bills that are not evidence-based medicine, that are not based on things that we know to be, indicated and safe. And one of the things we know that is actually very common and exceedingly safe is the termination of pregnancy. There was very recently a National Academy of Sciences, Engineering, and Medicine report that described exactly how safe this is. And unfortunately, the biggest determinant of how safe an abortion is for a woman in the United States is her zip code. State-based restrictions that work to limit the access that was given to us by Roe v. Wade, especially those that are not based on medical evidence, are more likely to decrease the safety of pregnancy and termination rather than to quote-unquote protect the women that these laws claim to serve. Establishing the Reproductive Healthcare Act, working with evidence-based medicine, and therefore preserving the right of women in Rhode Island, under whichever circumstances may come in the future, to terminate their pregnancies safely and effectively is crucial for maternal health and safety in the state. We've seen in other states that when restrictions or bans are put on terminations in a given area, what suffers not only is safety but equity. We heard an example earlier about an option that a woman in Texas had to possibly be able to fly to New York and have a safe termination, but require a lot of money to do so. If it were to get turned over to the states, women of means would be able to seek safe and legal terminations elsewhere. Women without would not. It would be even more disproportionately affected by unplanned pregnancies, and it would widen rather than close health disparities. And as someone who really enjoys caring for some of the most vulnerable populations in Rhode Island, I can't imagine what that would look like for those women. And I want to also thank Susan for her difficult testimony. As someone who is herself 32 weeks pregnant, I can't imagine what that decision must have been like for you. I also want to thank you all for taking the long time it has taken for us to give our testimony and allowing us to participate in this democratic process. I am happy to take questions as a person and also as a family physician.
Thank you, Doctor. Any questions? Yes, Vice Chair Jello.
Doctor,
Yeah.
you spoke of laws in other states that actually make abortion more dangerous. Could you give an example of such a law and how it makes abortion more dangerous there?
Sure. I have been trained to provide terminations, and I did some of my training in Minnesota. The Midwest sort of states actually have several laws that limit how far something can go. And I remember caring for a woman who had come from North Dakota. In North Dakota, terminations can be performed up until about 12 or 13 weeks. She had had irregular periods, thought she was well within the time period to obtain a legal and safe abortion in North Dakota. And when she arrived, she was further along than she in fact thought. Something that is known is that the further along a pregnancy goes, the more risky a termination procedure is. And unfortunately, she was not able to obtain it in her home state. She instead had to keep working for another couple of months in order to earn the money to travel to Minnesota, get a hotel room, have someone who'd be able to drive her after the procedure, pay for the now more expensive procedure that she was further along. And by the time she came to us for a termination, she was 22 weeks along. That is a riskier procedure than one that could have been done at the 14 weeks she had been when she first presented for her medically indicated termination. That's one example, for example, of things that have happened. I'm unfortunately not a lawyer and therefore not an expert in state laws across the country, but that is one patient care example that I have cared for in the past.